we still assume we know better than the patients. But when it comes to aesthetics, we need to have an open discussion with the patients.
Welcome to the LearnSkin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
You know, I'm looking good, feeling good, but how about you? What about that looking good part?
Yes, absolutely. All patients come to my clinic, always want to know, what can I do for my wrinkles? What can I do for my lines here? How can I do this or that? And I have a great trick. You want to hear my trick?
I can't wait to hear it.
I tell them, you have to see Dr. Who. And they say, what? Who? And I say, you have to see Dr. Who, and all your problems will dissolve. So can we get Dr. Who here? Because that's my trick.
Yeah, you're talking about Dr. Shasa Hu, and she is an associate professor at the University of Miami. You know a thing or two about that dermatology department, don't you?
I was not kidding. That's what I do.
We are super excited to welcome you, Dr. Hu, to our podcast, and we're going to be talking about all kinds of cosmetic-related conversations, and including skin of color. So welcome to the podcast.
Thank you both. Thank you, Raja. Thank you, Hadar. I'm very excited to be on my very second podcast and speaking on a subject that's dear to my heart. I love what I do, so I'm very blessed to be here to speak to you guys.
Absolutely. And you're a woman of many talents, but today we're going to tackle the issue of aesthetic and cosmetic procedures because you have so much to share. And, you know, one of the things that scares me, and that's why I send these patients to you, is injecting in high-risk areas. Can you maybe tell us how you go through these kind of a thinking algorithm? How do you identify what are those areas that are maybe more risky and both patients and clinicians should be aware of, and then how you approach them specifically?
Absolutely. I personally think safety is really the number one goal when you're injecting patient, treating them for wrinkles, for fine lines, because what we're doing here in cosmetic dermatology is not medically necessary. So first, do no harm. This is why when I practice cosmetic dermatology and when I teach cosmetic dermatology, safety is always like the number one priority on my mind, followed by outcome, followed by long-term maintenance and longevity of the results. So when we talk about safety, why do we care about safety? That's because with this rapid rising industry of aesthetic dermatology, we're seeing more and more complications when things go wrong, and things can go very wrong. I think one of the worst nightmare for injectors is really blindness from filler injections. And that is typically caused by when the hyaluronic acid gel or other material that you're injecting retrograde embolize into the artery supplies the retina, the central retinal artery. So even though the central retinal artery is a branch of the ophthalmic artery, when we look at the skin, look at the facial head and neck anatomy, we know that there are multiple branches of arteries on our face actually communicate with branches of ophthalmic artery. So just based on looking at anatomy, going back to Netter's first year of medical school, the high risk zones of head and neck typically includes the nose. So when people get that so-called liquid rhinoplasty, so when they fix their nose with hyaluronic acid injection, that's a high-risk area. That's because our nose is supplied by dorsal nasal artery as well as the lateral dorsal nasal artery. So the lateral nasal artery is a branch of the facial artery, but that communicates with the nasal artery, which is a branch of the ophthalmic artery. So as you can imagine, If you inject the hyaluronic acid and intravenous, that travels into the dorsal nasal, and then that can occlude through retrograde occlusion into the central retinal artery. So following the nose, we have the forehead and the glabella. Again, the key vessels here, we're looking at supratrochlear and supraorbital. Both are direct branches of the ophthalmic artery, so that communicates with the central retinal artery. And based on studies looking at the cases of blindness and where a filler was injected, we also need to worry about other areas such as the nasolabial fold. So here we're treating patients and injecting directly next to the facial artery. Again, facial artery communicates with ophthalmic artery through anastomosing channels on the nose via lateral nasal and dorsal nasal. Even when you look at areas such as lips, so lip filler is probably the number one requested or performed hyaluronic acid filler procedures in the US. Lip filler has complications for not only local occlusion, but blindness have been reported when people inject a filler into lips and inadvertently introduce the filler gel material into superior labial, and then that can retrograde embolize into facial artery, our angular artery, dorsal nasal, etc. So these high-risk zones in the face, in particular in the central face, is really because the anatomy of arterial supplies. And of course, at the end of the day, anytime you're injecting someone near a major vessel, you have risk for occlusion. So really, when you look at the face, I think I like to treat every single patient, every single case as high risk. That's how I minimize my complication.
See, Raja, that's what I told you. I just send them to Doctor Who because it's so hard to keep track. And she didn't even address what happens when there are anomalies because not everybody's anatomy is the same, right? So, there's some things that you just can't prevent. And, if you do work, complications will happen. But this kind of approach makes total sense to try to avoid as best you can. Now, just to put this for our listeners, because I think some listeners may be freaking out right now, can you tell us how common is it? I mean, it's clear that you need to see an expert. I think that point is made. But how common are these kind of complications?
And you know what? I'll just want to add, it's not also who, but how, right? So Shasa is also going to tell us a little bit about the how.
It's definitely both. So I actually just did the talk at the Cosmetic Bootcamp on high-risk injections and complication. So when people looked at FDA MALDAY database, which is like a database that collects all the reported adverse events, including filler injections, I think there were about 47 cases of blindness over the course of 10 years, like from 2007 to 2017. And there were about 48 cases of partial vision impairment.
Wow.
Yeah. So, I mean, honestly, I think the authors estimate the risk to be about 0.4%. So 0.4% risk for blindness. Obviously, that number is just a number because I'm sure it goes higher if you're injecting around the nose, it goes lower if you're injecting on the cheek.
And clearly, you don't want to be that one patient or that one doctor that it happened to. So, that's one of those cases where even if it's a rare event, you just want to avoid that. It's just not a good outcome. Like you said, when the treatment is worse than the disease, that's not a good outcome. Clearly rare. Okay.
And then interestingly, so Hadar, you were saying, people may get scared. So I actually tell my patients when I'm treating them, especially correcting their dorsal nasal hump or treating their glabella, I say this procedure has high risk. There's definitely a risk of blindness. Are you sure you want to do this? So I do a thorough informed consent. Only those patients who are really, really, really interested in the procedure, who really understand why there's a risk, then we'll go ahead and do the procedure.
That's very smart. I love that approach. And, I think one of the ways to avoid mishaps is to make sure that you have open channel of communication with your patient. And that's true for everything that we do, right?
I have a question here. Now, when you're working with the different sorts of hyaluronic acid products that are on the market, Are there some that you think are going to be at higher risk for occlusion or higher risk for, say, any sort of side effects based on maybe the thickness or the G prime? Does any of that matter?
Absolutely. The rheology, so the mechanics of the filler is definitely a factor. Studies have shown when you work with thicker products with higher G prime, you have higher risk of occlusion. Probably because number one, you are pushing a thicker product through a same gauge needle. So that may require higher extrusion pressure. So the higher injection pressure, higher risk for a vessel occlusion. And then, of course, secondly, when you do occlude the vessel with a higher G prime, thicker product, you may have more of a trouble, like it may become more difficult to dissolve with the hyaluronidase, such as Hynanax or Vitrace. So it's very important to think about the appropriate product to use, like what to use when you're treating the patient. Like, for example, when I treat the nose, I use a very thin products such as Volbella, which is a very soft HA made by Allergan. So that's a easier product to push through and easier product to dissolve in case of complication. When people looked at worldwide data on blindness, this is another interesting fact I think people find very fascinating. In addition to HA filler, the higher risks are actually associated with fat grafts and a more permanent filler. So in Asia, so speaking of skin of color that we kind of alluded to earlier, very popular to correct that flat nasal bridge and also give people fuller forehead because that's really more of like fortuitous facial feature. So in Asia, it's very important to have certain facial features as for like good luck as well for beauty. So these two procedures were associated with high numbers of blindness because people injecting fat instead of hyaluronic acid because fat gives a nicer outcome, but then unfortunately is also associated with higher risk for vessel occlusion.
I love what we're talking about here because, it's really getting into the art and also the safety of fillers. And, now that Hadar is sufficiently scared in a corner in a fetal position, I wanted to learn a little bit more about what are some of the actual pearls and approaches. But before you get to pearls and tips, Shasa, tell us a little bit about how many years of training did you go through to get to being really good at doing these injections? And then when you started doing the injections, how long did it take you before you felt truly comfortable?
Wow. So this is my 13th year in practice. So I started injecting literally right after graduate from residency. But, as a resident, we trained in resident clinic, but the volume was low. And my cosmetic practice took about 5 years to grow. So I will have to say this is such a rough estimate, like really a guesstimate. I think I cannot say I still feel comfortable. I am one of those practitioners who take my time, do every case. I know what I'm doing, but I don't ever take my skill for granted, if you know what I mean. I never just say, oh, hey, this is a no-brainer case. I'm just going to inject this lip. Everything's going to be fine. Because what Hadar knows, we see referral cases like, people mess up things and then patients come to us ranging from autoimmune disease to wounds to skin cancer and cosmetic complications. So seeing those complications from outside clinics really gives me this perspective that I don't ever think I can say confidently I am a pro at X, Y, and Z. I know that I'm good, but I still get scared every day.
You know what? I love that. I love the humility there. I think all of us, Hadar, you do wounds all the time, but I know you get scared about that one wound that you just might miss that ends up being something really crazy, right? And I know
Absolutely.
I'm always thinking in the back of my head, the more you know, the more you realize you don't know.
Right, exactly. So I every day I go into practice, I am like, well, I hope this is going to be a good day.
Yeah. So speaking of what we don't know, we don't get as much training around skin of color. And we know for sure that when you look at aesthetics, I mean, leave alone the textbooks where there's not much on skin of color compared to Caucasian skin. But especially when it comes to aesthetics, a lot of the training is not focused on skin of color. So can you talk a little bit about what are the unique characteristics that you need to take into account when it comes to looking at skin with darker pigmentation and skin of color in general?
That's a great question and a very important topic because we are seeing more patients with skin of color coming into our practice asking for procedures, asking for rejuvenation, how to treat certain area of the face. Interesting, a lot of patients of a skin color, typically they will come in and say, I really don't want to look like so and so, like a celeb. We all know, like influencer, typically Caucasian ethnicity or race. So that typical high cheekbone, very projected chin, very filled face, plump lips. A lot of skin of color patients find that unattractive. For my Asian, for example, for my Asian patients, they definitely do not want big cheeks. So that cheek projection is not considered attractive or beautiful in Asian patients. On the other hand, my patients of African American descent, they don't want big lips. They usually have great lip proportion and volume. So they care more about the marionette lines, they care more about the nasolabial fold. And at the end of the day, it's about preserving someone's unique beauty. We don't want to create
Love
clones
it.
of Kardashians. That's really the bottom line. And another thing I have learned from my practice is that you have to talk about aesthetics in skin of color. I just remember distinctively a month ago, this gorgeous African American mom in her 40s, she came to me. She's like, I came to you because I saw your before and after on Instagram, a patient of my skin color. That's why I chose you. Because apparently she went to other physicians, just assumed she wanted X and Y, Z, did not even discuss what she wanted and gave her treatment plan based on what they thought she wanted. So, that's kind of sad, but I think it's important to also recognize that a lot of times we as physicians, we still assume we know better than the patients. But when it comes to aesthetics, we need to have a open discussion with the patients, particularly when we're treating patients with skin of color or with different facial features from our ethnicity. So everyone has different beliefs. So just recognizing other people's values is a very important part of the cosmetic consultation.
That's so true. Absolutely. And, I wanted to switch gears to talk about patient selection. And for that, I would like to tell you my first cosmetic patient I've ever done, because that's a story I tell residents. And what I did is, the first patient came in when I was a resident, and I told him, what do you want to do? And he said, I'm getting married in 3 weeks and I want to inject Botox. And I said, and you come to me? I've never injected a person in my life, and you're going to ruin all your pictures. Go away, and you look great, and come back after the wedding. So I feel like a lot of times it's important to know when to say no.
Absolutely.
Yeah. So can you tell us what kind of red alerts go in your brain when you say, this is not the case for treatment today?
Right. Number one, as you said, time, expectation. If a patient want me to make them look certain way within a limited time, and that expectations may not be realistic, that's definitely a no-no. Secondly, previous history of surgeries, including radiation. So, for example, a lot of my more mature patients getting cosmetic procedures, they may have had skin cancers on their nose. They may have had blepharoplasty. They may have had radiation therapy to upper lip for a skin cancer. All those are very relevant histories because prior history of surgery, radiation dramatically increases your risk for vascular events because now you're working with tissue that has been moved, tissue that has been radiated. There may be already some vessel anomaly. So it's important to discuss with these patients, listen, we can do X and Y, Z, but the risks are much higher. So why don't we do this instead? And of course, if the patient does not agree, then you can just kindly say, okay, but I do think the risk is too high. And I have said no many times. And I think trust in your instinct is probably just as important as knowing what you can do.
And if I can say, that's such a tribute to our profession, because clearly there's a temptation there. These are very lucrative procedures, and to say no to someone, I think, speaks highly of the ethics of our profession. And certainly I know that you're not the only one. Most board certified dermatologists that I talk to are very clear on what they're comfortable doing and whatnot. And kind of tying it all back, it all goes back to good channel of communication with your patient. You want to be very clear about what can be done, what cannot be achieved. So certainly perfect points there.
Right. It's absolutely. And a lot of times patients are very anxious. They're impatient, especially if they come to you already had overfilled or poorly filled under eye or lips. So my first suggestion will be, let's dissolve them and then start over. Patients will be like, well, can we just like work around it? Like, I don't want to get bruised again. I already pay a lot of money for that procedure. So this is where you really need to use your, I would say, a doctor, put on your doctor hat, explain to patient why it's important to dissolve certain things, why it's important to follow the protocol by, starting with a cleaner, better canvas, rather than just giving in the pressure, say, okay, fine, I will work around it. So that never has good outcome because I treat those complications. So as Hadar is saying, it's important to do the right thing and explain to patients why you need to do this.
Well, I think we've learned a lot today. I think we spoke about how to select the right patient, when to say no, how to communicate well with the patients. And I think even if you're not a physician, just listening to this and going and shopping around, I think you're smarter now. You understand the considerations that need to be considered when you're thinking about an aesthetic procedure. Certainly seek out your board certified dermatologist, especially for those high risk area. Thank you, Dr. Hu, for reviewing this. And I want to thank you for your time, for your expertise, and for teaching us all.
It was fun. Thank you both. Raja, come to Miami and we'll fix you up.
Sounds good. Hey, Raja, what are you doing this October 22nd through the 24th?
There's only one right answer to that question. The 4th Annual Integrative Dermatology Symposium.
Of course. Now, a question. Are you going to travel all the way to Sacramento, California to meet me in person, or are you going to join virtually in your pajamas?
Pajamas in person? Well, you might see me in pajamas at the Sheraton Grand in person in Sacramento, or maybe I'll be in a Jolly Folly costume. Who knows? But I'm excited to chair this hybrid one-of-a-kind conference with you, Hadar.
Well, man, I do love this unique event our team just put together. This is an event that really takes an integrative approach to common patient questions, also an integrative approach to challenging dermatology diseases. We also are going to cover aesthetics and have practical takeaways to start using in the clinic right away, just when you come back. So, this is the kind of information I just can't find with any other meeting.
So true. And the good news is it's not just for us. It's for practitioners of all backgrounds, and everyone is welcome. Use our discount code IDS25 at checkout for 25% off registration. And you can find us at www.integrativedermatologysymposium.com. Come say hi and tag us on social if you'll be there. And our tag is @IntegrativeDermSymposium.
We hope to see you there.